Greetings, hi, how are you? This is Dr. Walid Sharawi. I'll be teaching anatomy and physiology. Since this is a asynchronized course, basically I'll try to upload some of the videos just to make things a lot easier for you. My highest recommendation for you guys, just to go along with the week by week, course by course, or chapter by chapter, just take notes. Make sure you go through the PowerPoint slides. Make sure you go through the notes. Take as many notes as possible, and hopefully everything will be simple for you guys. Anatomy and physiology just requires just to understand the basic information, like the backbones. Usually, I go along with the backbones. So, for instance, if we're talking about the body positions, or basically the postures or the anatomical positions, just understanding that hey, there's anatomical positions. You need to know the medial from lateral, the proximal from distal, cephalic from caudal, the different cut sections for the body. So, for instance, so we could talk about the cut sections like the mid-sagittal section, the coronal section, the transverse section. Those are different sections. Super important, super simple for you as well. Now we have like the quadrants, like the abdominopelvic quadrants. Quad is 4. So we would subdivide the body quadrants or the abdominopelvic quadrants into 4 different quads or regions. Then we have something is called the abdominopelvic regions, which is different than the quadrants. The regions are subdivided into 9 different regions. So definitely we will just go over it, and there will be lots of PowerPoint slides about it. It's super important to understand the basic backbones of the medical terminology. So, for instance, if you need to write down like a medical report or to pass on some information, you need to describe it in anatomical positions, the anatomical words, and the proper wording for it. So, for instance, if we're talking about the gallbladder, you just say, hey, this is the gallbladder. Do not say the word bladder, because I might be thinking about the urinary bladder. And those are 2 separate systems, 2 different locations, and 2 separate pathologicals or pathologies as well. So just make sure you're down to the point. Another thing that's super important is just to make sure you're talking about or to differentiate between right and left. So if we're talking about the right upper arm or the right arm versus the left arm, those are super simple structures, but super important for the medical terminology as well. So for instance, if a physician or a surgeon is supposed to be amputating a limb, and you write down a medical report that hey, the right lower limb needs to be amputated, instead of writing right, you write down left. So this is super important, and this is a very common medical error, and unfortunately that individual will be losing both limbs as well, because they have to go back into the operating room and amputate the limb, the proper limb. So make sure you don't lose the patient's limbs. Make sure you just take the extra second just to denote, hey, this is right or left. Make sure you would talk properly or write down the proper procedure about the gallbladder or urinary bladder, or just to describe the proper procedure for the physician as well. Okay, so hopefully you guys will entertain and enjoy learning more about anatomy and physiology. Super simple, and if you follow through, everything will be a lot easier. Thank you very much, and welcome to my class. Thank you.